Hey Kelly, because I hit the recording late, will it still catch everybody that's in the chat?
I am not certain, but I can make a quick note though, so we have it.
Okay, thank you. For anybody who's just joining, please put your name and agency in the chat so that we have it for attendance. All right, well, I think I'm gonna start. My only problem is if I get to slide 4, then that's where Kay takes over. So she should be coming any minute. We were on another meeting together, so she should be coming anytime. So let's see if I can get this up. She was gonna share for me too, so. Kelly, can you see the PowerPoint?
I can.
Okay. So hello, everyone. I am Melissa. I am a program specialist with Community Health Partnership, and we are meeting today to talk about the request for proposals for the CHWs for the Rural Health Transformation Project that we received funding for. So obviously, we're going to go through, if you haven't already put your name and agency in the chat, we are going to talk through the CHW
Yeah, really
proposal.
muted.
What's that?
So for the summer, you want to plan it for
Oh.
30 on Wednesdays. Yes.
So put your name and agency in the chat if you haven't already.
Yes. Right. Yeah. You can,
So
the
what
kids,
is,
5 minutes ago,
oh, who that is?
It's Rachel, I believe, is who we can hear.
Okay.
That's okay, because you get done. A second.
Two.
Oh, I thought she said my name.
You weren't on mute, Rachel.
Oh. Thank you. I don't know. I have to go.
Okay. So what is the Rural Health Transformation Program? So the Rural Health Transformation Program is to target systematic challenges and deploys long-term solutions in rural communities by increasing access through technology use. And it is also going to work to increase CHW workers and prioritize chronic disease management. So the goals of the CHW initiative are to expand access to community-based health navigation and support, improve chronic disease prevention and management outcomes, strengthening local workforce capacity through CHW training and credentialing, building sustainable models for CHW service delivery, including sustainable billing practices, and increase participation in evidence-based programs such as Getting Ahead or Women to Women. So what we're going to do today is we are going to review the RFP, requests for proposals. And then talk about the available funding and stipend amounts for each individual navigator slash CHW contracts, what the contract timeline looks like, and then eligible organizations and agencies. Kelly, is Kay here yet?
I do not believe so.
Okay. So this was Kay's part. I can kind of talk about it a little bit. There's going to be 4 different deliverables for the CHW and the funding structure. So originally we had it that you would have to complete all 4 of these deliverables in order to receive the full $20,000. But then we had decided that we could do it for chronic disease management or just navigation services. So it's kind of broken down into these 4 deliverable areas. The first 2 deliverables are for chronic disease. So it's completion of chronic disease training, which is the $5,000, and implementation of 1 chronic disease strategy, which would be the other $5,000. And then there's 2 community navigation sections. So community navigations where you are doing 5 hours a week of navigation services within the community. And that would be a deliverable for $5,000. And then progress to initiate or enhance CHW billing services. So that is actually required for all CHW contracts. So the chronic disease and the in-person navigation would each have to have the billing services. Kelly, can you kind of help me on that, or are you not really sure either how that's all broken down?
Yeah, no, I think you did a great job. Oh, and Kay just jumped on. Look at
Oh,
that.
there she
Saved
is.
by the bell.
Yay. So, Kay, I kind of walk through these 4 CHW deliverables and funding structure, but can you kind of speak to this a little bit more? Because there's the ability to do chronic disease and the navigation, but you can do all 4 deliverables as well.
Correct. And this is very much directed in part by the way the state issued our letter of intent, in that the chronic disease is a very large component. So the chronic disease partners that apply for those would be basically receiving 15,000, because it doesn't make any sense to do training if you're not going to do a strategy. For the most part, we're anticipating chronic disease would be a $15,000 contract. And if you're doing community navigation, it would be 10 because you'd have the navigation and then the 5,000 for the billing. And then if you're doing all of them, it would be 10,000 or I'm sorry, 20,000, 5,000 for each of them. And so this is something that is, again, directed by our grantee, which is why we can't really deviate from it, and why everyone is required to do billing, because that is also a requirement. And then, Melissa, do you want me to talk about these additional options?
Yes, please.
Okay, so there's additional requirements. Some of them will probably seem common sense, but obviously we're going to have reporting that's required to the Michigan Department of Health and Human Services. We don't have our contract yet. We have some ideas of what the metrics are going to be, but they have not given us those directly. So we're asking for patience on all of our partners' points. However, we are trying to be proactive so that we're not up against timelines that are going to be problematic. And that's why we're having this meeting now. We have the award, we've been awarded. Our budget has been resubmitted in a format that CMS needs to approve. So we're waiting for CMS, the Center for Medicaid Services, Medicare and Medicaid Services approval, and then they will do our contract. So that's where we're at, but we're still wanting to have this meeting because of just wanting not to be behind the timeline. We will be as ready to go as possible when we have our contract finalized. And so there will be reporting related to whatever MDHHS is requiring. We also felt, based on what we knew about their metrics, that it might not be exactly everything we want to know. And so we included in our budget an evaluator, which will do an RFP and select someone, could be from Michigan or another state, that will help specifically to determine return on investment for each of our partners. So if you are a community health worker contractor, we would want you to define what metrics will tell you that this program has return on investment for your mission, for you financially. And so it's going to be very customized to what you want to show. So that you can, at the end of this project, make a valid determination how you can sustain the program either in whole or in part. Um, so that is going to be very customized to you. And we're not going to ask you to collect something that's hard to collect with that because you're determining it. And then our goal as a region or as a, overall entity would be to take all of that evaluation data that each of the contractors have kind of designed for themselves and have a report for the region, like how our community health workers benefiting our region, which would possibly give us opportunities to seek other grants or funding to be able to continue to help support the effort in the region. So that is what would also be required is participation in that. It's going to be very self-directed. And then also, we have found that learning among people who are doing similar programs is invaluable. And so we would require participation in a CHW learning collaborative. It will probably be a continuation of the existing CHW work group that some of you already attend, but might just shift its focus a little bit because there will be more grant specific things we'll be talking about, and more on chronic disease. So it might shift a little bit, but we wouldn't be likely asking you to attend two different CHW meetings. We would likely just have one, just in respect of your time. So those are additional requirements. And then there would be additional opportunities that your organization could participate in. And so as you're preparing your RFP response to this, you could include some different things. So micro-credential training is something we have budgeted for and can cover the cost for your CHWs that are participating in this project. And that might mean getting a mental health micro-credential or an elder care micro-credential or a substance use micro-credential or whatever you need for your individual CHW to help them be even more valuable and successful for your organization. So that micro-credential is going to be, again, very customizable for your needs. And we will cover the cost of that training for you so that it's not an additional cost to you. We also, because the Women to Women program that we had piloted before was focused on chronic disease, we are hoping to get some of our CHWs interested in providing that and collecting some more than self-reported data. Previously, our evaluation was very strong as far as the results, but they were all self-reported, which has limits as far as how you can persuade a insurer, for example, to pay for them. But if we can show some actual like BMIs or follow through on medication protocols or compliance with visits or any of those kinds of things, those would be important. And it will depend on, obviously, the organization. A hospital would look at that possibly differently than a community-based organization. But so we would be looking for some partners who want to do that. And we've budgeted $2,000 per program. The Women to Women program is I think we ended up with 11 sessions. It's more of a coaching role for the CHW. The actual education is provided through a at your own pace online education program, which is more than just like watching videos. There's actually a peer specialist that you interact with, and discussion rooms, and it's more robust than, hey, we're just going to watch these videos. It's more dynamic. And it's the only one that the Stanford Chronic Self Disease Management Program actually allows for an on-demand program. So they kind of have the market cornered. But that program would be the education piece, and that is actually 6 weeks. So then what the coach does, or the CHW, is they meet with the participants a few times before, to kind of make sure they understand what the online piece is going to be, to get them acclimated to, what is a chronic disease self-management program all about. And then during the 6 weeks of the program, the CHW meets weekly with them, the group, to like share what they learned and just talk about what the content was for that week. And then the following week, after the 6 weeks, is more of a, so you finished your program, now what? And, a time for referrals to other programs like MSU Path, or local programs for diabetic education, or other things. So it's a time to give referrals, but also to help people hopefully have goals and continue the momentum of what they learned in that 6 week education program. So that's what the Women to Women program is about. If someone is interested in doing, one program in the year, they would get 2,000. If they want to do two programs, it would be 4,000. I'm not going to say we have unlimited funds, but depending on how many are interested, I think we'd like to see a number of those done throughout the region. And then the other small group intervention is the Getting Ahead program, which is designed to help people with limited resources kind of go through their resources, think about community, what community resources there are, how does poverty affect our community and myself, and set goals in a plan for getting ahead in a getting by world. And some of you might be familiar with that. We have been doing that through the Thumb Opioid Response Consortium, and with a little bit of funds from our other 4-year grant, but that funding is both ending soon. So, and that also would be 2,000 apiece. And that is a 16-session program held in person. We also have funding for compensation cards for the participants, but we can't buy food. So we can't do anything related to the food, but we can pay for your staff to do that. We also pay for the certification training and anything related to that. And then for both of these programs, we know that we have to recruit participants. And so we budgeted some funds for recruitment events. And so if you were interested, for example, in doing a Women to Women program, and you're like, we'd like to have a little meet and greet or a health fair, and we would use that $1,000 to maybe pay for some screening tests, or we have to be careful about purchasing items that might be considered swag. We're not allowed to buy swag, so really have to be mindful. But if it's for like to pay for cholesterol screenings or supplies for that, or even other things you might offer at that day, it can be used for those things. And so we have that you can add into your proposal. And then the other broader piece is all your organizations could be part of the referral partner hub. And that anyone, it doesn't have to be just someone with CHW, it could be somebody who isn't having a CHW, could apply to be a referral partner in the community hub. And we have built in $5,000 stipends for each referral partner, because we know on your end it takes time. And it takes looking at policies, and it takes orienting staff, and all of that takes your time and energy and resources. And so we built in a stipend for that. So that's, again, just another optional thing that you could plan on as part of your partnership with the CHW, or if you walk away today and say, we don't think we are right for a CHW, but we'd really like to be a referral partner, or we'd really like to provide getting ahead programs. I think we have some flexibility to do that outside of the CHW contracts, but we certainly want to have a lot of strength. And obviously, if CHWs are in the position to do these, that makes a lot of sense. You just have a more comprehensive RFP than, a lot of siloed RFPs. So, and then we also have a client support fund. In all of these, again, our final budget isn't approved, but as long as they approve the budget we have submitted, we have about $160,000 that we wrote in for client support. Those were only allowable if the person was already a participant, and it's supposed to support someone's journey towards wellness, right? So the idea is like we're not just doing one-off helps. We're actually taking someone who, gosh, they're part of my women to women group and they don't have enough for diabetic supplies for testing. So, and their insurance won't cover it. They have no other avenue to get these supplies. So we're going to put in a request to the client support fund. Or we have a Getting Ahead program participant who's in that Alice funding group that doesn't qualify for housing assistance, doesn't qualify for this, doesn't qualify for this, but they're about to get evicted because they had some car breakdown and all their money went to their car. And so we're going to ask for this client support for this person. The goal is to help people get connected to the resources that are already exist in the community. But then when the system doesn't have what someone needs, that these CHWs and people who are facilitating the Getting Ahead groups and the women to women groups will be able to step in and help them so that we make sure people aren't falling through the cracks and it's not such an uphill climb. And so that client support funding is very specific based on our funding limitations, what they say we can do. That was a lot on this slide, so I actually am going to pause to see if there's any questions now, because by the end you might have forgotten like all the information that was on here.
Hey, this is Lisa from List. I do have one question about the Navigator grant funding. So we have wonderful intentions of our navigators to do a lot of navigator things in a month, but we never hit a very high goal in terms of hours. And so like a commitment of 5 hours per week seems like a lot for us. So can we apply for less money or it's got to be 5,000 and that's it?
Well, we wanted to try and make the reimbursement as straightforward as possible rather than having to have people keep track of time and submit that. We've just learned, Grant, that that's a challenge. Um, as far as the 5 hours, one of the things that we are flexible on is how those hours get met. It could be that you have open office hours from 1 to 2, where people can call or stop in 5 days a week. It could be that, and sometimes maybe no one will come during those times. Or it could be that your outreach is partnering in the community. And we're not set on like it has to be exactly 5 hours a week. Maybe it's 20 hours in the month, because you go out to pop-up pantries, or you go out to the food banks, or you go out to Project Connect and you spend a whole day and you're interacting with people and you're providing support. Or maybe you partner with MDHHS like 211 does, or another organization, and go to recovery court, whatever it might look like for you. So we're flexible in those hours, probably more
Right.
than the amount. Does that make sense?
Okay, yeah, I think we can work with that then. We'll just have to craft a plan. So yeah, that works. Thanks.
Other questions?
Um, just to clarify, so the referral partner in the community hub, that's not going to actually be part of this current RFP. It will be additional one that comes out later.
If you are applying for this, you can apply for that now too. So
Okay.
you wouldn't have to apply again. But if there are other, because we actually budgeted way more referral partner stipends than CHW stipends. So we have, I think, enough to bring on 25 to 30 referral partners. So we will have another RFP, but if you apply for it here, you don't have to apply for it again.
Okay. Oh, and I guess one more question. I'm sorry. Um, so for this specific RFP for the navigation services, and it's required you have to do deliverables 3 and 4. So this navigation services and the billing. Um, and I've been out of the loop a little bit for the community health worker stuff, so I apologize. But is it so navigation is we're working with individuals to help get them insurance coverage. Is that billable? If they get the coverage, then you can bill for the service, I assume, like backdate it, or
So you're not going to be able to bill for the actual like enrollment, but you can bill for any other help. Like you could bill for helping with food assistance applications or making referrals for housing or the case management meetings with them and figuring out billing. And this is the thing. Could you go to the stages of billing slide, Melissa? So we understand some people don't bill at all right now for CHW services. We know some people are billing some. So the statement in the grant RFP is, or that we had to fill out was you have to bill or create a plan to bill. So that's how we built this is if you are not billing, you're at stage 1. So we would want you to move to stage 2, which is that you have a billing plan in place and any training you need to do that is completed. If you are ready to implement, then you actually move to stage 3, right? If you're at stage 2, like, okay, we have a plan, we know what we need to do, but we haven't started billing, we would expect you to try to move to stage 3 in this first year, where you've put in place your procedures, you've done your startup activities, and you've started billing. If you're already billing, we would hope that you would move to stage 4 and look at different ways to expand. And maybe your determination at the end is there is no way for us to expand. We're already doing everything we can do, but maybe you could do some staff training, or maybe there's some additional Medicaid health plans you could work with, or some additional codes for Medicare or commercial payers, or, maybe there's a way you could improve billing documentation. We're going to be, again, pretty flexible on that, especially if you're already billing, because we want you to see if there's any money being left on the table to be able to, again, the goal is for you to have a sustainable revenue source. And to support that, we already have a education program planned for June 10th. Very introductory. It's just an hour and a half, but we've got 3 speakers that are going to talk about different billing models for Medicare, Medicaid, and then the health department's going to present on how they braid funds to support their community health workers. So we're going to do our best to support you. The goal is that everybody moves up the ladder from wherever you're starting at.
that
So does
helps.
that answer
Thank
the
you.
question?
Yeah, thank you.
You can go back now, I guess, Melissa. Any other questions?
I just saw Tammy's got her hand raised.
Go ahead, Tammy.
Well, I'm in the process of doing the billing stuff. Our biggest issue is getting the credentialing with the insurance.
Mhm.
Yes,
How,
we are having
how
that
would
same
that
problem.
work?
So, Tammy, I don't know. We're not experts in billing, but we will find what we would do as our role in this is help connect you with someone that has figured it out. My understanding to some degree is not everyone has figured this out yet. So we are hoping to be able to bring resources to that as long as you are working on it and showing that you're working on it, the 5,000, you would be paid the $5,000 stipend because sometimes there are things outside your control.
Right.
But we would be willing to do whatever we can, whether it's connect with somebody in the UP who's figured it out, or and I guess that's the thing we're hoping we'll be able to get from being part of this project is that we will find ways and resources from others that we can share with all of you.
So I don't know if this is possible, but I think it would be so helpful if we could actually talk to the insurance companies. I don't know, like, okay, if you have any in, but the like Medicaid health plans, so Molina, Medicaid, Meridian, HAP, like just having a representative from the insurance company to be able to talk to and say, how do we go about this? How do we get you to pay our claim? Because we're in the same boat. We've had to write services off. I mean, we're doing them, we're trying to bill, but it just hasn't happened yet. And Molina right now, we are actually have meetings set up with them for other things. So we've had their ear. Hadn't had a client yet for Molina to actually bill, but we're hoping when we do bill to Molina that they will pay. But that would be, I think, super helpful for us because that is the only way we're going to get reimbursed is if we can get those credentialing issues hammered out with the Medicaid health plans.
I agree, because it should not take over a year to try to get credentialed when that's part of the process they want you to have for billing.
Well, and I think, and I don't know how much weight we would carry, but if we have, for example, 10 or 15 organizations that are part of this initiative, and we go and we say, we have 10 organizations that need to be credentialed and they're having problems. Can we set up a meeting? Like, I think maybe it will carry a little weight. Not to saying you guys aren't doing your best. I'm sure you are, but like Lisa said, to get their attention and respond, like that's sad that that's not happening with you individually approaching them. But if there's any way that we can advocate and use the power of numbers to maybe have them pay more attention, we certainly are willing to do that. I think we have contacts, but I don't think they're in the same departments as what you guys are working in. So we can try through our contacts to find someone, but not sure if we'll be able to, make that line connect. But we certainly are willing to reach out to our contacts and do whatever we can.
That would be great. Thank you.
Yeah. Other questions?
Okay.
All right, Melissa, I think Melissa's going to talk about what you're actually going to write in the RFP. And I'll just say one overarching, we don't expect you to write a book because we have to review all of them. So if you can be concise and to the point, that's important. Um, and don't feel like you have to like we didn't put page limits on it, but honestly, we wouldn't expect them to be much longer than 5 to 10 pages at the most. I think we didn't talk about that. That's just me throwing it out there. If Kelly or Melissa think differently, I'm thinking we want you. We don't want to waste your time. We want your time to be valued in preparing this. But we also need to have enough information if there's 20 applications to be able to pick the ones that are going to be most successful.
Agree. We did not talk about that. But I think 5 to 10, by the time I walk through all these slides, I think 5 is easy once you answer all these questions. So I'm going to walk you through the RFP proposal content quickly, just so we can leave some room at the end. So if there's any more questions that come out of this. So your proposal content, organizational interest and capacity. So why are you interested in being a contracted CHW partner? And how does this program align with your mission and current services? Describing your past and current CHW program and or efforts to carry out the goals of this program with other staff. And if you don't currently have a CHW program, describe any similar efforts or programs that you currently do have. Your CHW staffing plan. Do you currently employ a CHW or not? Will you hire a new CHW or train an existing staff member or utilize an intern? And describe what your plan is to support and supervise the CHW. If the funding from TCHP will not cover the entire cost, what other funding do you have available to support that CHW? Anticipated challenges or solutions. What challenges do you foresee in implementing a CHW program, and how will your organization address and overcome these challenges? Program implementation based on the programs you are planning to implement. How will you implement CHW navigation services for 5 hours a week? And what chronic disease strategy are you most interested in implementing? Evidence-based programming. Are you interested in offering Getting Ahead? And then Women to Women, and how many participants do you anticipate annually for either of those programs? After completing training for chronic disease self-management program, how do you plan to implement the program, and how many participants do you anticipate annually? And then do you have any other chronic disease management programs that you plan to have the CHW provide? And then again, how many participants do you anticipate annually? Participant recruitment. Do you have existing events or programs that can help support recruitment? If you do not, what strategies will you use to recruit participants? And then under this section, indicate if you are interested in holding an education event from which you can recruit women to women participants. And then as Kay mentioned before, there was, I believe it was $1,000 for funding available to assist with hosting these events. Billing and sustainability. What is your current capacity to bill for CHW services, and how do you plan to build or expand billing capabilities? And then all contracts are required to address billing and sustainability. Kay, this is back to you with stages of billing. I don't know if you want to go over it again. I know you kind of talked about it previously.
Just pretty much the same as what I already said. We certainly want to help you with this. Um, you're not the only ones, those of you who express challenges. I've heard from others around the state that there are challenges, so we will be there to support you in trying to accomplish this part of your contract.
And just another mention, that June 10th webinar, we do have a flyer for that with a QR code that has the tiny URL in it as well, so you can register for that if you're interested. I will make sure that that gets posted. I think it's, Kelly, do you remember, did we put it in the RFP? I can't
It
remember
is. I
offhand.
don't remember, but I just put the link in the chat.
Okay, that works. Thanks, Kay. I was gonna say, if not, I can mail it out afterwards, email it out.
We are planning to send out these slides too. If any, that's a question anyone has, we'll send out the slides.
Okay. Kay, proposal review criteria is you.
Yeah. So we didn't want to get too complicated, but we are this is an RFP, so we certainly want to be objective and transparent. So this is the scoring structure. The organizational readiness and alignment, 5 points. Staffing plan, 10 points. Your implementation approach, 10 points. Because of the federal emphasis on both chronic disease and navigation services, in any proposals that include that you're going to do all of 4 components would receive 15 additional preference points for those being willing to take on all 4. And so that is something that is important to us. The commitment to evidence-based programming. So if you're willing to offer women to women or the Getting Ahead, there's 5 points for that. Your recruitment strategy and community reach, 5 points. And then your plan for sustainability and billing, 5 points. We will, We have budgeted for 10. Well, I should say we budgeted for $200,000. So if we had all full programs, there'd be 10. But if we get some that are only applying for just chronic disease or just navigation services, we'll probably have more than 10 availability funds. If there are less than that many applicants, it's not going to be guaranteed funding, but there would have to be some major deficiencies not to be funded. If we have more, we will, in addition to the score, we do want to look at the geographic distribution because we are a four-county collaborative. And so we certainly want to make sure that we have geographic representation if possible. If you provide service in more than one county, I would make sure that you spell that out somewhere in your proposal. We didn't have a specific question to that effect, but if you are a multi-county provider and your CHW will be benefiting more than one county, I would ask you to please include that information somewhere. And then we are allowing more than one application from an organization. It wouldn't be just to get more money for the same CHW, but if you had three locations and you wanted a CHW in all three locations, and that was your approach, then you could submit more than one application. We will look at again the number of applications we receive, trying to distribute geographically, but also we wouldn't want to overload contracts with one organization if we have multiple partners that are interested. So you are able to submit more than one. We may give more than one to an organization, but we will look at, being fair to multiple organizations if the quality of the application is equal. Any questions about the proposal content or how we're going to score them? The other thing, it's not on the slide, but if we have enough money to fund everybody and all of them are quality, we're going to just have an internal review by our team. If we do not, we will actually put together a review team. So it'll take a little longer. If we have more than what we have budgeted for, we'll have a review team that will look over everything and help us make the decision. Again, just to have that extra layer of transparency and objectivity.
Thanks,
Now
Kate.
I'll ask any questions on the proposal content or the review criteria.
Hearing none. All right, so application timeline and next steps. Obviously, this is all contingent on full execution of the MDHHS contract with TCHP. So all questions are due to me by May 29th, which is, I believe, this Friday. And then all of the questions will be answered and posted on the RFP landing page, which was within the RFP that was sent out to everyone. Those will be posted by June 2nd. Proposal due date by email to myself by June 8th, and then there's my email address listed. The review process is going to be June 9th through the 30th, and then award notifications will be anywhere between June 12th to June 30th, and then contract start dates are July 1st. Obviously, assuming everything gets approved and we have our signed contract and we can move forward with everything. Are there any questions on any of the dates? Okay. And then we are just going to do open Q&A. So does anybody have questions over everything that was reviewed? I can go back to different slides that anybody wants to look at again. And if anybody has questions, obviously you can email them to me until Friday. And then any questions that get asked, I will post them in that landing page with whatever question was asked with the answer so that everybody can review those as well.
I may have missed this. Do we know how long does this grant run?
That's a
Until,
trick question.
go ahead, Kay.
All right, I say that because initially our letter of intent is goes through September 30th, 2027. Whenever we're in conversations or emails or different things, it's always like, well, this is a 5-year grant. Your budget should be submitted for the first year for this time period. So we don't have an official award beyond next September. But the implications have been that if everything goes well and we do what we say we're going to do and we have a good outcome, that there will be additional funding periods. I think that's partly because that's how their federal contract is. So, like Michigan's future years aren't a given, they have performance objectives they have to meet. And so, because their funding is not guaranteed. They're not going to promise any funding to the rest of us throughout the state without that. So I'm hopeful that this could be a 5-year project. But at this point, we only have funding through September 30th, 2027.
So just so I have my information correct. So assuming the attendees or awardees receive $20,000, that those funds would go through until September 30th, 2027, and then the application process would start over in every year or every for 5 years, and
You
then
know,
there would be after
yeah,
after September 30th.
because we don't really know, it's an unknown. It could be that, instead of the money we're getting this year, which some of you might know, you might be part of our board of directors or been part of other meetings where we've talked about it. Our entire allocation, which includes this as well as other components, is $1 million. I don't know if we're going to get $1 million every year. So I don't know if maybe the next year we'd only get 500,000. So we'd need to do this plus other things. So it could be less money. It could be that we just, based on how they've written it, we just do a continuation with our current awardees. I don't, it also depends how many people apply. I mean, I don't see. I think we budgeted enough money for the people that are interested. So I would anticipate we should be able to continue. But without having any guarantees on our own funding, it's really hard to say what's going to happen after next September. So your 20,000, you will be able to, you'll have it, it's yours. And then hopefully we'll be able to continue. And we're also going to learn things this year. Maybe the stipend approach doesn't work. And we'll have to use a different strategy next time, or maybe it works great and we'll be able to continue just the way we are. But definitely the first year through September 30th. And as long as CMS approves how our budget is structured, it will be stipends the way we have them outlined today.
Okay, thank you very much.
I wish I could be more guaranteed or more decisive, but unfortunately, we just don't know. Other questions?
All right. If there are no more,
Can I ask one more question? So are we able to bill, this is a billing question, are we able to bill services that are Medicare patients that are already receiving chronic care management type services? So they're billing on their end, and I know there's strict rules about billing. If they're receiving this service, they may not be able to receive a different service. So if we're billing CHW services, would we also be able to bill chronic care management?
So my understanding is Medicare came out with a whole new set of Z codes, which is about the extent of my billing lingo. New Z codes that were supposed to go into effect in March, and specifically allowing for CHW billing. One of our speakers on is going to go into that and explain that some more. And that speaker is connected to our federal Office of Rural Health grant. I have been told they are available for one-on-one consultation as well. So we will be able to hopefully support you with an expert that can talk about those new codes and how they interact with other existing codes.
Thank you.
Can you talk about what it means to be part of or what it entails to be part of the referral partner hub?
Yeah, so we are currently building that airplane. And so we have a steering committee that is looking at um, technology and procedures to make referrals more closed looped so that you can make a referral and actually know if the agency got the referral, if the client came in, and whether or not you need to follow up, sort of. And we actually, that's why I was a little late. We just came from a meeting. Saginaw and Bay have already built their systems and launched. And so we were learning how their systems are structured because it would probably make a lot of sense to be able to have some similarities and at least two systems that would work well together. As they pointed out, there are organizations, and actually, Jackie, yours would be one too, that cover the thumb counties, but also are in Bay and Saginaw. And so the idea is that community health workers could make a direct referral to a food pantry or to other organizations right through that system. And it's set up to be able to even create an integration between the EMR and the system so that the organization wouldn't have to have like two systems. They could just use their EHR if they so choose. If they decide they don't want to, they could use a separate system. But we're just working through that. But the referral hub partner likely would be part of that technology. However, I could foresee a potential where someone would, because they're small maybe or other reasons, choose that they want to be part of the referral hub, but they want to do old school like faxing referrals or different things. All of those details haven't quite been worked out, but being a referral hub partner basically would say we are willing to look at all this technology, how we could benefit from being a part of it, and we want to make referrals seamlessly within the thumb, basically, is what a referral hub partner would do.
Okay, great. That's helpful. So just active participation and willingness to use it and refer people
Yes.
and receive referrals. Okay, sounds good.
Any other questions?
All right. I just want to thank everybody for coming to this, and don't forget to get registered for June 10th if you want to be a part of the Sustainable Strategies webinar with the Medicaid Medicare billing. I want to go back. This is my email address, deming@thumbhealth.org. And then I want to just pop back to all the dates. So questions are due to me by this Friday, and then they will all be answered by June 2nd on the landing page. And I will also have the recording of this meeting posted on that landing page probably by the end of the day tomorrow. I'm hoping to get it up today, but we'll just be realistic and say tomorrow. And then proposals are due by June 8th. So if there are no other questions, I will let you guys go and give you 5 minutes of your day back during your lunch hour.
Thank you.
Thank you,
Thank
everybody.
you.
Thank you, everyone.
Bye.
Bye.
Thank you.
Should we just